Okay, my name is Sylvia, and I'm going to be doing the blood transfusion skills checkoff today. So, as a responsible and ethical learner, I will uphold personal integrity by not engaging in any form of cheating, unauthorized collaboration, fabrication, falsification, or any other act that will compromise the integrity of the skill testing recording today. So prior to me going into my patient's room, I'm going to grab all of my orders, make sure that I have my blood, and that I'm also going to administer the blood within 30 minutes from when I receive it from the blood bank. So when I receive the physician's orders, I want to make sure that I review them and that I have um, the specific blood type that I'm going to be giving, that I have any possible complications that the patient may have had if it's documented in the chart. I will also want to check for um, any post transfusion or pre-transfusion medications that I may need to give. So prior to or after, depending if they've had any side effects in the past or if they are potentially running a fever, which we'll discuss in a little bit. But I want to make sure the orders match, that I have the right timing to start, that I have the right date, that I have the right blood to infuse, and that everything is lining up. So then I also want to make sure that I have my patient's consent form signed. Just confirming it, everything's signed, everything's good to go. It was signed within the parameters of when I'm going to be giving the transfusion. So I can get rid of that. And physician's orders too. So then what I will do is I can then come into my patient's room. I'm going to close the door, give privacy to my patient, perform hand hygiene, and I'm going to come in, and this is Michael Schofield. So, hello, Mr. Schofield. My name is Sylvia, and I'm going to be giving you a blood transfusion today. I checked in with your doctor, and it looks like the orders are there to start right now. I already have the blood work dropped off by the blood bank. Sorry, I already have the blood that was dropped off by the blood bank, and I have already also checked the MAR to make sure that we have done a type and cross for you, and I have checked, and that was done within the last 72 hours, so we are good. I have checked the MAR to ensure that we have the adequate orders, meaning that your hemoglobin is low, so therefore that's the reason why we're giving you a transfusion today. So can you please verify your name and date of birth for me? Okay, perfect. Okay, now do you have any questions for me in regards to how this transfusion is gonna go? No? Okay. Do you have any allergies that we should know about? No? Okay. Have you had any transfusions in the past? No? Okay. Have you, obviously you haven't had any reactions, but if my patient would have answered yes, he's had transfusions in the past, I would ask if they have had any kind of reaction, even the slightest reaction. So what I would do now is I'm going to perform baseline vital signs for my patient. So I want to take blood pressure, respiratory, heart rate, temperature, and of course any pain level. I want to make sure that if there is by any slight chance that there is a fever, so anything greater than 100, then I want to notify my provider and before I start the transfusion. Okay, so then what I will do is I will go ahead and check your IV access, please. Perfect. The IV looks good. There's no infiltration. There is no redness. There is no edema noted. Now, what I'm going to do is to make sure that the line is good. I'm going to have a saline. I'm going to put on my gloves, and I'm going to grab alcohol swab. I'm going to scrub the hub over on the where the line is, the IV access line. I'm going to flush the line and make sure that it flushes properly. If that does flush properly, then that is a good indication that I am set to go. I'm going to remove my gloves, perform hand hygiene, and then what I will do is I'm going to start my checks. And my first check with the blood is going to be by myself. So what I'm going to be checking is I'm going to be checking the product information on the tag with the sticker on the blood itself. So I'm going to go through the unit. Unit is 2121515. That matches my bag. Unit expiration date 12/18/2025 at 23:59. That matches my bag, and I am infusing red blood cells, and it's B negative, and it's a volume of 300 mLs. Perfect, that matches my bag. So this is where my second nurse would come in now. What I will do is I do have a second student here with me, so I'm going to be reading off the information, and then my second student nurse will go ahead and verify that we do have the correct information. So she will check the patient's band, and I will have the bag in hand. So I will start by saying we have Michael Schofield.
Michael Schofield.
MRN 145678.
So the MRN is 145687. Can you confirm that?
MRN 145678.
Interesting. I have 87.
Okay, so if this was the case, this is a perfect example. If this was the case, I would stop and I would send this back to the blood bank because we do have a discrepancy in the MRN, although we were given the wrong band. So we are going to assume that MRN is 145678.
145678.
Date of birth 1/15/1977.
1/15/1977.
And this is a B negative blood type.
It's not on.
Okay. So now my second check has been done. Now what I will do is with my second student nurse, I will give her the blood transfusion record, and we will go through the third check together. Here you go. If you can help me out, please. And now we will start again with our third check. So I have Michael Schofield.
Michael Schofield.
MRN 145678.
MRN 145678.
Date of birth 1/15/1977.
Date of birth 1/15/1977.
Unit number 2121515.
Unit number 2121515.
Unit expiration date December 18th, 2025 at 23:59.
And expiration date is 12/18/2025 at 23:59.
And what I'm giving is PRBCs.
Yep, packed red blood cells.
And it is negative, B negative, I'm sorry.
Yes, B negative.
And I'm infusing to 300 mLs.
Yes, 300 mLs.
Perfect, thank you. Thank you for helping me out, appreciate it. Okay, so now I'm going to be looking over what is asking. So I already have my baseline vital signs. I have documented that. Like I said, if there was any fever over 100, I would make sure I do not infuse, and I instruct my physician of what's going on. And again, I want to make sure that I do this in a timely manner, because I need to make sure that I'm infusing the blood within 30 minutes from when I receive it from the bank. And then I'm going to start my process. So what I will do is I'm going to perform hand hygiene. I'm going to put on my gloves. And I'm going to start with my line. So when it's near line, you shouldn't have it all wrapped. But I would take this time to talk to the patient, kind of ease their nerves a little bit, just conversate so that they're not feeling anxious. And yeah. Gonna open the door. Okay. I never want this to touch the bed or anything, so I would hold on to it. Close my door. And I like hanging this part just so it's not dangling and I'm not having to worry about where it's touching. It has the cover, so I am okay there. Then what I want to do is I want to make sure that everything is clamped. All my line is clamped. Okay, I'm going to start by grabbing my saline. I'm going to spike my saline. Ensuring that everything is clamped. I'm going to hang my bag. Okay, that's done. Now what I'm going to do next is I'm going to actually, before I hang this, I'm going to prime it first. So it's asking me, do I want to prime? I'm going to say yes. I would put this over the sink, or if there was another designated area, then I would put it over and prime it that way. So it's asking me, do I want to prime? And I'm going to say yes. Make sure that I prime my line. I'm going to unclamp. And I'm going to unclamp. Otherwise, you get the alert that I just did. Okay. So, there we go. Prime, yes. Yes, it's disconnected from my patient. And I'm going to give it okay. My line is primed. I'm going to stop it. I would let it prime all the way, but for time's sake, I'm going to stop it. I'm going to clamp my bag just so it doesn't drip out. I'm going to hang this again just so that I can, there you go. Now I'm going to grab my blood now, and it is very crucial that I complete the correct steps. and that I am careful not to touch anything else so that I can prevent any sort of infection. I'm going to spike my blood. And before I turn it around, I'm going to make sure that everything is clamped so that I am not wasting blood. Sorry, excuse me. All right. Now what I want to do next is I need to set my pump. So what I will do is I'm going to go in and clear out infusion. Yes. Okay. Then what I want to do is I want to set my primary and my secondary. So I guess we could do it two ways. We can set in a primary and a secondary so that when the blood is done, then it automatically takes in the saline at the same rate that we set it. Or we can also do it just one as full primary, which will mean that I unclamp the saline, let that go. When I am done running the saline through, then I will run the blood, and then when the blood is done, then I can go back to the saline. I can do either or. What I will do is I'll just set it as one. So to start off, I will set my rate at 75. Okay. So 75. So I want to do, to start off, I want to do 75 mLs per hour. Okay, so I got that done. And now what I'm going to be infusing is my 300 mLs. Okay. (300 mLs per hour). It's my volume to infuse. I want to start the infusion slowly, just so I can keep an eye on my patient and make sure that they're not going to have any adverse reactions or any fluid overload. So I have my pump set and starting at 75. What I'm going to do now is I'm going to clean the hub on the IV. I'm going to connect my line. Okay, it's connected. And now what I'm going to do is I'm going to unclamp my blood. So the saline already started, it's already all the way to the end. I have primed my line, so I know it's good. I have also flushed my line, so I know that's good. What I will do now is I can start the infusion. Okay, and I'm gonna move it over so it's not dripping all over the patient. So I'm gonna start infusion. Okay, I'm gonna make sure that I'm unclamping my blood. So now that's gonna go through. I also want to make sure that I'm going into my filter and filling in my filter about third ways of the filter's way. So as we can see, the blood is already going. The minute that the blood hits, there's an occlusion. The minute that the blood hits my patient, what I'm going to do is I'm going to start my timer. I'm going to do a 15-minute timer. Okay. However, I'm going to hang this just for the sake so it doesn't get the bed wet. But what I want to do is also I want to go back to my infusion record and look at my orders. So my orders state that I need to check vital signs, and I need to see the patient's reaction within 5 minutes. In 15 minutes, what I want to do is I'm going to assess the lungs for any crackles or any symptoms of overload. I want to assess the heart for any abnormal arrhythmias. And then I also want to check temperature, blood pressure, pulse, respiration, ask if there's any pain, and assess the overall of my patient. So look out for any hives, look out for any problems, any problems with breathing, any problems with being able to stay awake, and yeah. So then what I need to do is, if there is a problem, so if I were to suspect any problem, then I immediately have to stop the infusion, and I need to report the finding to the provider. If there is no problem with my infusion at 15 minutes, what I need to do is I need to increase the rate. So what I would do is I would come back to my pump, and I would change the rate on my pump. So I would stop the infusion, come back to my pump, go to my rate, and I would set my rate to 200. Okay, 200 mLs per hour. Everything's look good. I've documented in the chart that the patient looks fine. I'm going to start my infusion at 200 mLs per hour. Then in the first 15 minutes, one thing is, I never want to leave my patient's side. I need to make sure that I am always with my patient, and that I am assessing any changes in status of my patient. So I need to know any, like I said, tackle, which is like overload, and or I'm going to check for the trolley, which is any injuries to acute lung injuries. My orders state that I need to check the vital signs again in 1 hour, in 2 hours, 3 hours, and 4 hours. However, we do not want this blood to go for more than 4 hours, because it can create an infection. So if for whatever reason the blood was going to be over 4 hours, I want to stop at the 4-hour mark, and then I want to make sure that I document, let my provider know, and also I need to return the blood back to the bank. However, because we set the rate at 200 mLs per hour, we are going to be within the time frame. Let's say my patient was done with the transfusion. I'm going to remove, I'm going to clamp the blood, okay? And now I'm going to unclamp the saline, and I'm gonna have the line flush out at the same rate that the blood was going. So that's 200 mLs per hour. After that has been done, I get rid of my bloodline. I dispose of it in the proper place. Then I'm going to document that my patient received whatever amount of blood that he received. In this case, he received 300 mLs. What kind of blood, what reaction, and if there was any spike of fever or anything, any reason why I needed to have called the provider. And then I'm going to make sure that my patient is comfortable, that the bed is locked, that the rails are up, that it's at its lowest position, and that I have documented everything, and that I have removed my gloves, that I have performed hand hygiene, and I think that is it. Yeah, that's the end of it. Sorry, I had a nice laughing attack. But in the real world, it will happen. Thank you.